funding, raising funds online, and requiring additional disclosure by small business initial public offerings, IPOs. If either amendment passes, the bill will then go back to the House. If both amendments are defeated, the bill goes to President Obama. Senators will also vote on a number of judicial nominations. And now to live coverage of the U.S. Senate here on C-SPAN 2.
The Senate will come to order. The chaplain, Dr. Barry Black, will lead the Senate in prayer.
Let us pray. Eternal God, the captain of our souls, you know every temptation and trial we face. Give our lawmakers today the wisdom to be good stewards of the bounties you have given and to trust you to deliver them from evil. Make them pure enough to use wisely the wealth we call ours, as they remember that to whom much is given, much will be required. Allow no hunger for attainment or thirst of ambition to drive them to align themselves with wrong. Lord, strengthen them to serve you this day with right choices and unswerving loyalty. We pray in your merciful name. Amen.
Please join me in the Pledge of Allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The clerk will read a communication to the Senate.
Washington, D.C., March 22, 2012. To the Senate, under the provisions of Rule 1, Paragraph 3 of the Standing Rules of the Senate, I hereby appoint the Honorable Tom Udall, a senator from the state of New Mexico, to perform the duties of the chair. Signed, Daniel K. Inouye, President pro tempore.
Mr. President.
The majority leader is recognized.
Following leader remarks, the Senate will be in a period of morning business for an hour. The majority will control the first half, Republicans the final half. Following that morning business, the Senate will resume consideration of the capital formation bill. Filing deadline for second-degree amendments to the motion to concur with respect to the Stock Act is 10:30 a.m. this morning. At about 12:30 today, there will be up to 7 roll call votes, including completion of the IPO bill, the Stock Act, and confirmation of 3 judicial nominations. Mr. President, I was disappointed to see in the newspaper this morning and hear on the news that the Republicans in the House have decided just to not mess with our highway bill. A bill that we spent 5 weeks on here, a bipartisan legislation, a piece of bipartisan legislation that will save or create 2.8 million jobs. They are so disorganized, such a state of disrepair, the House of Representatives, that they can't even extend the highway bill. I don't know what's in their mind, Mr. President. This program was started by that radical liberal Dwight Eisenhower, who decided, after having tried as a major under orders from his commander to bring a caravan of military vehicles across the across the country, that the roads were awful. So he remembered that all during his military service. When he became President of the United States, he said something needs to be done about that. The interstate highway system was the brainchild of Dwight Eisenhower. And now the Republicans in the House are talking as if this is some socialistic program that was developed at Harvard or some other radically liberal place. Can't imagine what their mindset is. Barbara Boxer, one of the most liberal members of this body, Jim Hoff, one of the most conservative members, came together on a bill that we passed on a bipartisan basis here. The vast majority of Democrats voted for it, the vast majority of Republicans voted for it. It was a good bill to save or create 2.8 million jobs. But over in that big dark hole we now refer to as the Tea Party-dominated House of Representatives, they couldn't do it. They couldn't agree on it. They couldn't agree even on their own bill. They destroyed their own bill. And now they wouldn't even agree to take up our bill. The funding for our highway system terminates at the end of this month. I'm not inclined to go for this short-term extension they're going to send to us, Mr. President. They're going to have to feel the heat of the American people. They meaning the Tea Party-driven House of Representatives. Mr. President, the initial public offering legislation will be here on the floor, debated for the last time in just a short time. It'll pass. The bill is far from perfect, but it's a good bill. It will help capital formation, and I'm glad we're able to pass it on to the House. I'm hopeful that the good work done by Senator Merkley, Warner, Bennett, and others will help the minority will wrap their arms around this and pass it. I hope that they will agree to pass the Reid Amendment. We'll soon know about that. But the bill is going to be gone, sent to the President real soon, if the House agrees to help us with the legislation. Mr. President, 2 years ago tomorrow, President Obama signed the Patient Protection and Affordable Care Act into law. It was the greatest single step in generations toward ensuring access to affordable, quality health care for every American, regardless of where they live or how much money they make. Millions and millions of Americans have already felt the benefit of this law. Seniors are saving money, millions and millions of dollars, on their prescriptions and their free checkups. The donut hole is rapidly disappearing because of this bill, this law, I should say. Insurance companies can no longer set arbitrary lifetime caps on benefits, putting millions of Americans in one car accident or heart attack away from bankruptcy. See, Mr. President, what they would do is you thought you were in good shape. You had an insurance policy, a health insurance policy, and you get in a car accident or you get cancer or some other dread disease, and you're in the process of being taken care of, and you're told your bill's not going to be paid anymore. Your limit was $10,000 or $50,000, and they stopped paying the benefits. Under this legislation, that can no longer be done. That's why the President signed the bill. Under this legislation that is now law, children can no longer be denied insurance because they have pre-existing conditions, a protection that will soon extend to all Americans. And in 2 short years, in fact, it's less time than that, virtually every man, woman, and child in America will have access to the health insurance they can afford and vital care they need. Mr. President, they will have the same kind of insurance you and I have, basically the same insurance. And for people to rail against this plan of President Obama, as they call it, I haven't seen a single one of the Republicans that rail against this law say we don't want our insurance because it's government insurance. Every member of the United States Senate has the same insurance that we, by law, are giving to everyone in America. My Republican colleagues who berate this bill, let them drop their government insurance. They hate this so much that we're trying to give the American people, have them drop what they have, because it's the same thing, basically. No longer will hundreds of millions of Americans live in fear of losing their insurance because they lose their job. And no longer will tens of millions rely on the only care they know exists, an emergency room. The most expensive care in America is an emergency room. Some people go without care because they have no insurance at all. Mr. President, this is not just a story I've heard from other people. Now, there are people who today have no insurance, just like my family had no insurance when I was growing up. Mr. President, we didn't go to the doctor. We didn't go to the doctor. No insurance. The only time that I can remember going to the doctor was when I was deathly ill, literally deathly ill. My parents had no car, and I had something wrong. I'd been sick for a long time. And my brother had somebody visit him. My mother asked if they would be good enough to take us over to the hospital, which was 50 miles away. And they did, and I had a growth on one of my intestines or something, and I was very, very sick. Mr. President, there are many people today just like I was as a little boy. They have no insurance. And they may be looking the same as me, to have, with no transportation, have a visitor take them to the nearest emergency room. That's what happened to me. The problem was our emergency room was 50 miles away. Unfortunately, Republicans continue to target the rights and benefits guaranteed under that law. If Republicans have their way, insurance companies will once again be allowed to deny care to sick children because that child has asthma or diabetes or some of the other situations that young people get. In Nevada, thousands of children with pre-existing conditions would once again be at the whim of insurance companies that care more about making money than about making people better. If Republicans have their way, young adults just out of college will be kicked off their parents' insurance plans. Mr. President, also that's something that I know exists today. Little town of Searchlight, where I have my home. A young man named Jeff wanted to go to school. He started at community college, doing pretty well, and he got pain in his groin. First it started out as a little ache, and then it got where he couldn't take it anymore. But because he was at an age where he was no longer able to stay in his parents' insurance policy, he didn't know where to go. So he went to the so-called county hospital, indigent hospital. He was diagnosed with having testicular cancer. He had been on his dad's insurance policy, but he arrived at an age where he was no longer eligible. His parents had certainly not much. His mother worked part-time at a post office. His dad had worked at a steam generating plant 50 miles away from Searchlight. So they begged, and that's stretching a little bit, but they borrowed and borrowed and borrowed to take care of his 2 surgeries, number of hospital visitations, chemotherapy. They paid for that. Thousands and thousands of dollars that they had to find a way to pay for their boy. Under the law that's now in existence, they could stay on their parents' insurance policy for 3 or 4 years more. Allow many young boys and girls to go to college, go find a job. They can stay on their parents' insurance policy. In Nevada, thousands of children with pre-existing conditions would once again, as I've indicated, be without the ability to be taken care of when they're sick. Almost 23,000 young adults in Nevada would once again have to defer their dreams to take a job, or as I just indicated, go to college, or risk going without any care. If Republicans have their way, seniors will pay more for prescriptions and checkups. We've had about 250,000 Nevada seniors who have now get wellness visits, cancer screenings, and other preventive services. This bill goes away. Won't happen anymore. Tens of thousands of seniors who saved millions and millions of dollars in Nevada alone on prescription drugs last year will once again be forced to choose between buying food and buying medicine. If Republicans have their way, taxes will increase for small businesses, and so will the deficit. Repealing health care reform would add almost $1.5 trillion to the federal debt. Not billion, trillion. When Democrats undertook health care reform, it wasn't just about saving money. It was about saving lives, and we did that. And while the numbers I've just discussed are very important, there's one number that matters more than all the others, 45,000. Mr. President, in the year 2011, 45,000 Americans died because they lacked health insurance. That's almost 1,000 a week. That doesn't include the tens of thousands more who are sick or dying because they have health insurance but still can't afford the care they need. After the rest of the Affordable Care Act has taken effect over the next year and a half or 2 years, no American will have to bear what President Lyndon Johnson called, and I quote, the injustice which denies the miracle of healing to the old and to the poor, end of quote. President Johnson knew that living in a country with the best medical care in the world doesn't matter if you can't access that care. That's why almost 47 years ago he signed Medicare into law. On that day in July, President Johnson celebrated an American tradition that, quote, calls upon us never to be indifferent toward despair. It commands us never to turn away from helplessness. It directs us to never ignore or to spurn those who suffer unintended in a land that is burning with abundance, close quote. So, Mr. President, we saved $500 billion in wasteful programs and other things, and Medicare, we extended the life of it for a dozen years and gave seniors the things that I've talked about today. Filling the donut hole, prescription drugs, wellness checks, and all the other things that are so important to them. The Affordable Care Act continues the tradition that President Johnson celebrated because it calls upon us never to be indifferent toward despair. It commands us to never turn away from helplessness. It directs us to never ignore or to spurn those who suffer unattended in a land that's bursting with abundance. The law makes certain that the richest in the nation, this great world of ours, never again turns its back on despair, helplessness, and many times hopelessness and suffering of the least among us. And it guarantees that no insurance company will ever again be putting a price tag on human life. Mr. President, I would note the absence of quorum.
The clerk will call the roll.
Mr. Akaka.
Mr. President. The Republican leader is recognized.
I suggest that the quorum be dispensed with.
Without objection.
Mr. President, I ask unanimous consent that Senator Grassley be allocated 45 minutes of the Republican time during the debate on H.R. 3606.
Without objection.
Mr. President, later today the Senate will take up an attempt to pass the Jobs Act. And so we find ourselves once again on the cusp of passing a bipartisan jobs package that will make it easier for entrepreneurs and for innovators to get the capital they need to build businesses and create jobs. As I said yesterday, this bill had overwhelming bipartisan support over in the House. Nearly 400 members voted for it, and the President himself says that it will create jobs. He supports it, and he would sign it when we get it to him. Yet for some reason, some in the Democratic-controlled Senate seem intent on slowing it down, and others want to essentially take a step actually backward and undermine a critical provision sponsored by Senators Toomey, Carper, and Hutchison, included in the House bill, and that was just this week endorsed by the SEC's Forum on Small Business Capital Formation. The Reid Amendment, Reid of Rhode Island, could subject thousands of businesses to SEC regulation unnecessarily, and the Senate should reject it. So once again, I ask them to reconsider. Let's put politics aside and pocket this important bipartisan jobs bill. The Jobs Act is a great example of the type of legislation we should all be able to agree on, and there's simply no good reason for delay. Let's get this done. Let's get it to the President's desk and have him sign it into law. Now, on another matter, Mr. President, yesterday I outlined a number of the broken promises we've seen in connection with the new Obamacare law. From the promise of being able to keep the plan you have and like, to the promise of protecting Medicare, to the promise of lowering premiums, to the promise of lowering health care costs. Democrats also said that taxes wouldn't go up and existing conscience protections would be respected. Looking back, it seems like there wasn't anything our Democratic friends, including the President, weren't willing to promise in order to get the bill across the finish line. But there's another category of disappointments, too, and that's all the aspects of this bill Democrats didn't even talk about before it passed. We all remember when Speaker Pelosi famously said, "We have to pass this bill so we can find out what's in it." And one of the things Americans found out about was something called IPAB, the Independent Payment Advisory Board. Now, this is an unelected, unaccountable board of bureaucrats empowered by this law to make additional cuts to Medicare based on arbitrary cost control targets. As a result of this new board, 15 bureaucrats would now have the power, without any accountability whatsoever, to make changes to Medicare. What's more, there is no judicial or administrative review of IPAB personnel or recommendations. In other words, they're accountable to no one. IPAB isn't answerable to voters, and it can't be challenged in the courts. Its main role, as the Wall Street Journal editorial board put it, will be the inevitable dirty work of denying care. The inevitable dirty work of denying care. In an effort to control spending, IPAB will limit patient access to medical care. It's that simple, and frankly, it's totally unacceptable. Republicans recognize the problem of Medicare spending and the need for reform. We also recognize that IPAB isn't the answer. This is just one more reason Obamacare needs to be repealed and replaced. And that's why even Democrats are co-sponsoring a bill to repeal it over in the House, calling it a flawed policy that will risk beneficiary access to care. So this isn't just a Republican issue. There is strong bipartisan opposition to this new law. Look, if the President himself doesn't even want to talk about this law anymore, and even Democrats are sponsoring repeal of parts of their own law in the House, it should be pretty obvious there's a fundamental problem here. We need to reform health care, but this reform made things worse. The evidence and broken promises are all around us. It's time the President acknowledged it, and it's time the two parties came together and did something about it. It's time to repeal Obamacare and replace it with the kind of common-sense reforms Americans really want, reforms that actually lower costs and which put health care back in the hands of individuals and their doctors rather than bureaucrats here in Washington. Mr. President, I yield the floor.
Under the previous order, the leadership time is reserved. Under the previous order, the Senate will be in a period of morning business for 1 hour, with senators permitted to speak therein for up to 10 minutes each, with the time equally divided and controlled between the two leaders or their designees, with the majority controlling the first half and the Republicans controlling the final half.
Mr. President.
Senator from Iowa is recognized.
Mr. President, first I ask unanimous consent that Tyler Bischoff, Sam Jones, and Nicole Berta of my staff be granted 4 privileges for the duration of today's proceedings.
Without objection.
Well, again, Mr. President, tomorrow we celebrate the 2nd anniversary of the signing of the Affordable Care Act into law. Our Democratic leader, Senator Reid, in his opening remarks today, I think outlined the tremendous progress that we've made in this bill. I listened to the comments made by our distinguished Republican leader, and all I heard was repeal Obamacare, but I never heard what they want to replace it with. They just want to go back to the old system where the insurance companies ran everything before, where people were thrown off their policies because they had an illness, where because of pre-existing conditions you couldn't get health care coverage, where we had this big donut hole, which we're now closing for the elderly. But the one thing I want to focus on this morning in my brief time, Mr. President, is to focus on an extraordinary element of the Affordable Care Act that's not being talked about a lot, but which members of my committee that I now am privileged to chair, the Health Committee, worked so hard to include in the Affordable Care Act. And that is the array of provisions that promote wellness, disease prevention, and public health. Taken together, these provisions have begun to jumpstart America's transformation into a genuine wellness society. They're transforming our current sick care system into a true health care system. I've said this many times. We don't have a health care system in America. We have a sick care system. If you get sick, you get care, one way or the other. But there's very little out there to help you keep healthy and to maintain wellness and to keep you from going to the hospital in the first place. Now, that would be a true health care system. And that's what we've begun to establish with the Affordable Care Act. By preventing chronic diseases, enabling people to stay healthy, stay out of the hospital in the first place. Right now, the United States spends about 75% of all our health care spending. 75% of the nation's health care spending is spent on chronic diseases, only 4% for prevention. So during the last year that we have the data for, 2005, the U.S. spent about $2 trillion on health care. Of every $1 spent, 75 cents went towards treating patients with chronic diseases, many of which are preventable. Only 4 cents went towards prevention. Now that had to tell you something right there. That's the old system. And that's the system that the Republicans want us to go back to, is this system. Spending more and more to treat people after they get sick, rather than trying to put something up forward to keep people healthy. Well, in the Affordable Care Act, we have tremendous opportunities to again move us to more prevention and wellness. We've made historic new investments in this area of prevention and public health. Now, here's one example of that right here on this chart. Before our health reform bill, our law was passed, just take the issue of colorectal cancer screening, which we know if you get it early and detect it early, your chances of survival are tremendous. If you get it too late, then you're going to be in the hospital and you're going to have cancer and you're not going to live. But we know by getting it early, we can prevent a lot of unnecessary deaths and illness and treatments later on. Cholesterol screening. We know if people get good cholesterol screening, they get either on a drug or on a good diet, an exercise program, reducing the prevalence of heart disease, and tobacco cessation. Need we keep repeating around here how much it costs our society from the plague of tobacco use in this country? Well, here's where we were before health reform. About 68% covered by colorectal cancer screening. About 57% were covered by cholesterol screening and only 4% from tobacco cessation. After health reform, now 100%. 100% coverage for colorectal screening, with no co-pays and deductibles, I might add. 100% coverage for cholesterol screening. 100% coverage for tobacco cessation. That's prevention. That's wellness, keeping people healthy in the first place. What do the Republicans want? They want to go back to this. They want to go back to this. We've made too much progress in prevention and wellness to go back to the old ways of just treating people after they get sick. Now, again, we've been able to promote a lot of activities around the country to promote health and wellness. For example, in Illinois, the state made improvements to its sidewalks and marked crossings to increase student physical activity levels. You might say, well, big deal. Well, it is a big deal. Because of these improvements, the number of students who are walking to school has doubled. Doubled. And it's expected to save the school system about $67,000 a year just on bus costs. So kids are healthier, you save money. In Alabama, Mobile County is using funds from this prevention fund to support tobacco quit lines to help residents live tobacco-free, again, under the tobacco cessation program. Officials also enacted a comprehensive smoke-free policy expected to protect 13,000 of their residents, this is in Mobile County, Alabama, from being exposed to secondhand smoke. So all across America, more and more is being invested in prevention. We know that, for example, a 5% reduction in obesity rate, just 5% reduction in obesity rate will yield more than $600 billion in savings on health care costs over 20 years. Again, in our prevention fund, out there, again, getting people the necessary supports and information they need to reduce obesity. So the misguided efforts to repeal the health reform law, again, most Americans know what's at stake. They're going to lose a lot of these prevention activities that enable us, again, to take charge of our own health care, to make sure that we get our colonoscopies on time, our mammogram screenings. Every woman in America now over age 40 gets a free mammogram screening. No co-pays, no deductibles. The Republicans want to take that away from the women of this country. Colonoscopies, as I said, without co-pays and deductibles. Republicans want to take that away. Annual physicals. We know that a lot of people didn't get annual physicals because it cost money. It cost them. Now you can get an annual physical free. No co-pays, no deductibles. Well, Republicans want to take that away. So again, I think we have to ask a question. Every time I hear the Republicans talking about doing away with Obamacare, our Affordable Care Act, we have to ask, are we going to cut short this transformation into a wellness society in preventing diseases, keeping people healthy in the first place? Well, I think the answer is clear. Americans are not going to allow all of these hard-earned protections and benefits in the Affordable Care Act to be taken away. We're not going to be dragged backward. We're going to continue our march forward to make ourselves more healthy. We're not going to go back to the old system where only a little over half the people in this country got cholesterol screening, 68% got colorectal cancer screening. We want people to get early screening, early support services for preventative care so they stay healthy. Not only is it going to help our family budgets, it's going to help our federal budget if we have people healthier and not going to the hospital in the first place. So this is one of the big aspects of the Affordable Care Act. It's not talked about a lot, but to me it's one of the most important aspects of moving us, again, to a society where we're not just relying upon people going to the hospital and paying for high hospital bills and things like that in the future. So, Mr. President, I'm going to yield the floor. I just wanted to make those comments about one aspect of the Affordable Care Act. Of course, we do know that there's many other things in the Affordable Care Act that people don't want to lose. Right now, We ban lifetime limits. Helps more than 100 million people. They want to take that away. Republicans want to take that away. We cover vital preventative service, which I just went over. Young people remaining on their parents' coverage up to age 26. More than 2.5 million helps so far. Republicans want to take that away. They want to end all that. Well, I don't think the American people want to end it. I think the American people want to move forward with this health care reform bill because we've made too much progress in making sure that health insurance is affordable, available. And, you know, I just have one more thing to say, if my friend from Rhode Island would just let me. Everyone here in this Senate body belongs to the Federal Employees Health Benefit Program. And you know what? We have coverage for pre-existing conditions. We have no lifetime bans on our policies. And yet, that's what we did. Remember the debate? We wanted to say to the American people, whatever we have, we want you to have too. Well, we put that in the Affordable Care Act. Now, the Republicans say, well, we're going to take that away from the American people, but keep it for ourselves. I don't think so. I don't think so. I don't think the American people want to say, well, you senators and you congressmen, you can keep all that, but you can take it away from us. We're not going to do it. We're not going to go backwards. And with that, I'm going to yield the floor to my distinguished friend from Rhode Island who played such a pivotal role in getting the Affordable Care Act through on our committee and has been one of our more eloquent spokespersons on this health care bill in the last couple of years. So I yield the floor to my friend from Rhode Island.
Thank you. Mr. President.
Senator from Rhode Island.
May I ask unanimous consent to speak for, say, 15 minutes?
Without objection.
Thank you. Let me first congratulate Chairman Harkin for his remarks today, but more than that, the work that has preceded today on the health care bill. He was an ardent advocate for the prevention programs that save lives and money, and it was a real pleasure to work with him at that time. Today is the second anniversary of the passage of the Affordable Care Act, and I want to describe how the law is already making a difference for families in Rhode Island and across the country by drastically improving access to higher quality care, by addressing rising health care costs, and by protecting consumers. Look at the changes. Children with pre-existing conditions were denied coverage. No longer. Lifetime limits on insurance policies left many American families struggling to pay medical care bills on their own. No longer. And insurers could cancel coverage for individuals who became sick. No longer. In addition, the law helps kids just out of school who all too often can't get that first job with health insurance. It helps them to stay on their parents' insurance policies until age 26. For seniors, prescription drug costs are down as the Medicare donut hole begins to close. This is real change, and it hits home in my home state of Rhode Island. I hear from Rhode Islanders, and I listen. I heard from Greg, a father in Providence, who told me about his 16-year-old son, Will. Will spends 2 hours every day undergoing treatment to keep his cystic fibrosis in check. In addition to this daily treatment and prescriptions, Will sees a specialist 4 times a year to monitor the disease. Greg said that he often thinks about his son Will's future and whether his son will be able to maintain health insurance coverage and receive the treatment that he needs. Thanks to the Affordable Care Act, Will does not have to worry about insurance companies denying him coverage because he has a pre-existing condition, or fear that he'll have to go without treatment because his medical bills will have pushed him over some arbitrary lifetime limit. As many as 374,000 Rhode Islanders, including 89,000 children like Will, can now receive the treatments they need free from lifetime limits on coverage. People who want to repeal Obamacare should be ready to look Greg in the eye and tell him why they want to take that away from him and his son. Olive, a senior from Woonsocket, shared with me that her husband takes several medications to help treat his Alzheimer's disease. A 3-month supply for 2 of his medications costs close to $1,000. As Olive said, those months go by quickly. Last year, Olive and her husband fell into the prescription drug donut hole in July. Without the Affordable Care Act, they would have been responsible for paying the full cost of his medications out of pocket. But because of health care reform, Olive and her husband received a discount on their prescription drugs and saved $2,400 last year. Olive and her husband are 2 of the over 14,800 Rhode Islanders who received a 50% discount on brand-name prescription drugs when they hit the donut hole. This discount resulted in an average savings of over $550 per person, for a total savings of more than $8.2 million for seniors in Rhode Island alone. People who want to repeal Obamacare should be ready to look Olive in the eye and tell her why that $8.2 million should go back into the drug companies' pockets, why she and her husband should have to cough up an extra $2,400 for the drug companies. Brianne, a 22-year-old graduate of the University of Rhode Island, currently works part-time as a physical therapy aide in Providence. Her job does not offer health insurance. Brianne suffers from several seasonal and food allergies, and she makes frequent trips to her allergist. Because of the Affordable Care Act, Brianne can stay on her mother's health insurance so she can continue to get the treatments that she needs. Without this coverage, Brianne said, she would be hard-pressed to afford the treatments necessary to address her allergies. As of June of last year, Brianne was one of over 7,500 young adults in Rhode Island who gained insurance coverage as a result of the reform law. People who want to repeal Obamacare need to explain to Brianne why she and those other 7,500 Rhode Island kids should be kicked off their parents' policy. The Affordable Care Act has also brought needed relief to employers who are still the leading source of health coverage in the United States. Jeff is a small business owner in Providence. He provides health care insurance for his employees because, as he said, it's the right thing to do. But the rising cost of his employees' health insurance has placed increased pressure on his business. Jeff's business qualified for the health care law's small business health care tax credit, which covers up to 35% of premiums paid by a small business owner for its employees' coverage. These credits are a lifeline for small businesses that are struggling in today's difficult economy and for the people those small businesses employ. People who want to repeal Obamacare need to look Jeff in the eye and tell him why they want to take away that tax credit lifeline that lets him provide coverage for his employees. The Affordable Care Act also provided support for community health centers. In Rhode Island, like elsewhere in the country, community health centers fill a critical gap in our health care system, delivering comprehensive, preventive, and primary care to patients regardless of their ability to pay. Dennis Roy is the CEO of East Bay Community Action Program in Rhode Island. He tells me that the Affordable Care Act has provided critical support for his community health center's mission. East Bay has received $3 million through this law to construct a new community health center in Newport, which, despite its international reputation, is one of Rhode Island's poorer cities. The new community health center will triple the available patient care space for needy Newport County residents. To date, Rhode Island community health centers have received $14.8 million to create new health center sites in medically underserved areas. This is important American infrastructure, and we should not tear it down to make a political point or to assuage a political ideology. These stories are just a few of many that show how the Affordable Care Act is working for Rhode Island families, seniors, and small businesses. And although we've made great progress, the work continues. Over the last 2 years, a tremendous effort has been made by the healthcare industry, by state and local leaders, and by the Obama administration to develop a better model of healthcare delivery, to shift from a system that is disorganized and fragmented to one that is coordinated, is efficient, and delivers the high-quality care that Americans deserve. Private healthcare providers like Geisinger, Intermountain, and the Marshfield Clinic are already focusing on quality rather than quantity, efficiency rather than volume, to better serve their patients and their bottom line. Because of the Affordable Care Act, the federal government now has the opportunity to support and encourage their focus and to deliver much-needed savings in the most patient-centered way by improving the quality of care and health outcomes. There is tremendous potential for improved care and cost savings in 5 key areas: payment reform, primary and preventive care, measuring and reporting quality, administrative simplification, and health information technology. Savings from a range of responsible viewpoints run from $700 billion to $1 trillion a year, all without compromising the quality of care Americans have come to expect, indeed, likely improving the quality of care. I will shortly release a report to Chairman Harkin and the Help Committee on the Obama administration's implementation of the delivery system reform provisions of the Affordable Care Act. And when I say delivery system reform, I'm meaning those provisions that improve the quality of care, that avoid medical errors, that coordinate care better, that reward prevention and primary care, that reduce administrative overhead, that reward who gets the best health outcomes, not who orders the most treatment procedures. I worked with Senator Mikulski on this project. She authored the key delivery provisions of the law and has great expertise in this area. These changes will make a real difference for millions of Americans, and I look forward to sharing the report and its findings with my colleagues next week. Before I close, I want to acknowledge Rhode Island's work on a state health insurance exchange provided for by the Affordable Care Act. Rhode Island is leading the way as the first state to receive a Level 2 grant funding to set up the exchange. The exchanges are common-sense, local, competitive marketplaces where individuals and small businesses will be able to purchase health insurance with the prices and benefits out there on display. When insurance companies compete for your business on a transparent level playing field, it will drive down costs. Exchanges will let individuals and small businesses use their purchasing power to drive down costs, much like big businesses are able to do. The progress made by state leaders, like our Lieutenant Governor Elizabeth Roberts, who's leading this effort, to get to this point, they are remarkable, and I urge them to keep up the good work. So whether it's changing the lives of Greg and Will, or Olive, or Brianne, or Jeff and his employees, whether it's building out our community health center infrastructure, whether it's supporting the private sector leaders who are pivoting to a new and better and more efficient delivery system, or whether it's something as simple as a marketplace for health insurance that's open, fair, and on the level, the Affordable Care Act has made a real difference for hardworking families in Rhode Island. I will continue to work hard alongside these leading health care providers, alongside the Obama administration, and alongside my colleagues here in Congress to see the full promise of the Affordable Care Act realized for this great nation's advantage. I thank the presiding officer. I yield the floor I see Ranking Member Enzi coming out. Is the senator, should I yield the floor to the senator, or you want me to put, I'll note the absence of quorum.
Clerk will call the roll.
Mr. Akaka.
Senator Sheldon Whitehouse speaking about health care ahead of the Supreme Court oral argument next week. 3 days of oral argument. We will bring you the same-day audio each day on C-SPAN 3, C-SPAN Radio, and cspan.org. Over in the House today, they are voting on whether to repeal part of the health care law, the Independent Payment Advisory Board. Here in the Senate, they plan to finish work today on the Small Business Capital Bill, which eases regulations on raising funds and taking a small business public. They'll vote on two amendments at about 12:30 Eastern, adding restrictions to crowdfunding, that's raising funds online, and requiring additional disclosure by small business initial public offerings, or IPOs. If either amendment passes, then the bill goes back to the House. If both amendments are defeated, the bill will go to President Obama. Also today, a couple of votes on judicial nominations, and they will consider a bill to ban Congress from insider stock trading that was passed in the House a couple of weeks ago.
Suspended. It's my understanding that the other side is not going to have their speaker to use the last of the minutes, so we'll go ahead and start on our 30 minutes. I'd also ask unanimous consent that we be allowed to do a colloquy and have several senators join in.
Without objection.
Thank you. We're actually going to be talking about Medicare today and the way that the Patient Protection and Affordable Care Act cuts into Medicare, destroys Medicare. 2 years ago, the President wanted a health care bill in the worst way, and that's exactly what he got. That's exactly what America got. Anybody that's out there that's on Medicare or about to be on Medicare or young enough that someday you'll be on Medicare should be really concerned about what's happened under this act. All of you, I'm sure, are aware of somebody that is on Medicare that's already been denied a doctor. Denied a doctor because they're not being paid what they ought to be paid. To call it the Patient Protection and Affordable Care Act is a major, major mistake. It neither protects Medicare patients nor makes it more affordable. In fact, one of the things we'll bring out today is that there's been a theft of $500 billion from Medicare to fund other parts of the program. There's some fraud in it because it was spent, but it still shows up in the account. That's how they show that this really doesn't add to the debt. And to solve the whole thing, they've got a whole new board of unelected bureaucrats to make additional cuts to Medicare to make it look like it's okay. And then there's the accounting sleight of hand. I'm one of the 2 accountants in the United States Senate now, and you got to pay attention to see it. But it goes back to the fraud, because if this same sort of thing were being done in the private sector, people would go to jail. And there are a number of ways that we'll bring out how that is not just budget gimmicks and not just sleight of hand, but actually taking advantage of seniors. The chief Medicare actuary said that Medicare will go broke in 2024. That's 5 years earlier than last year's report by the chief Medicare actuary. That's the guy that works for Medicare. He doesn't work for us. And he has to figure out each year how much in the hole it is and what needs to be done to fix it. And my contention, of course, is that you can't steal $500 billion out of a program that's already going broke and expect it to be fine. And we warned about that as we were going through the passage of this Patient Protection and Affordable Care Act, which, as everybody has mentioned, was passed 2 years ago tomorrow. It could have been fixed. There were 3 plans on the Republican side that would have done what is claimed to be done by this act. Those ideas were largely rejected. There were a few places that they fit in the same as what was in there, but were largely rejected. So today we're going to talk a little bit about some theft, some fraud, some unelected bureaucrats, and some accounting sleight of hand. And I have some people here that want to respond to some of the things that have been said. I think Senator Coburn listened to some of the previous comments that were made on the other side celebrating this great day.
Thank you, Senator.
From Oklahoma.
Ask that we have unanimous consent to have a colloquy among us.
Without objection.
I listened very intently to the first 2 speakers this morning, and have, as somebody who's now been a physician for almost 30 years, practiced full-time for over 25 years, I heard the senator from Iowa in what his desire would be in the chart that he showed. He showed 100% screening occurring now in 3 areas. Well, I want to tell you that isn't true. We're not screening. We hope to screen, and we hope to screen 100%, but the facts are on screening that was available was only used 5% by Medicare patients on the screening that was already available with no cost to Medicare patients. So we have to distinguish between what we desire and what's actually going to happen. But let's just take the example of colon screening. I'm a colon cancer survivor. I was diagnosed through colonoscopy with colon cancer. But let's take that example. And then let's take the example of the other aspect of the Affordable Care Act, which is called the Independent Payment Advisory Board. And what's the purpose of the Independent Payment Advisory Board? It is to cut the costs of Medicare through decreasing of reimbursements, first for the first 8 years, physicians and outside providers, and then starting in 2019, hospitals. Well, what do you think the first thing that's going to get cut? The first thing that's going to get cut is the reimbursement rate for a colonoscopy. So when the reimbursement rate for a colonoscopy goes below the cost, and it's very close right now, by the way, the cost to actually perform a colonoscopy versus what Medicare reimburses, when that is cut, what do you think is going to happen on screening? The goal of changing health care is an admirable goal. We know that $1 and $3 doesn't help anybody get well and doesn't prevent them from getting sick today. But what the American people need to understand is what is coming about is a group of 15 unelected bureaucrats who cannot be challenged in court, who cannot be challenged on the floor of the Senate or the House, mandating price reductions to control the cost of Medicare. What does that ultimately mean? They'll do their job. We won't be able to do anything about it. But what it means is they will reimburse at levels less than the cost to do services. And so consequently, what will happen? The service won't be there. They also are going to do what is called comparative effectiveness research. We know about comparative effectiveness research. If you're a practicing physician today, you have to do continuing medical education. Part of that medical education is knowing the latest competitive effectiveness research. It's like they're reinventing something that already exists. But the point is they're going to use that to deny or change payments for procedures that patients need. What's wrong with all this? What's wrong with all this is we are inserting a government board and government bureaucrat between the patient and the doctor. Think about that for a minute. When I go to my doctor, I don't want him concentrating about anything except me. And if he's looking over his shoulder about whether or not he met the IPAB's comparative effectiveness study on what he's doing for me, when in fact the art of medicine as well as the science may say they're wrong, and he's going to do what the government says rather than what he thinks is best for me, what am I getting for that? Now, I'll be on Medicare next year, much to my regret, because my choices will now be limited in terms of who I can see. The greatest threat to the quality of care, it wasn't intended to be that way. It was intended to be helpful. I don't doubt the motives of anybody that had set this board up. The greatest threat to the quality of care for seniors in this country is the Independent Payment Advisory Board. And their non-caring position, because they're going to be looking at numbers and words, and they're never going to lay their hand on a patient. They're never going to impact a patient directly. They're never going to listen to a patient, but they're going to make the ultimate decisions based on what that patient's going to get. With that, I yield back to my colleague.
But that board was made essential by decisions that were made in the health care bill. In the health care bill, we took $500 billion, $500 billion, that should have stayed with